In this video, we're going to go through an overview of psychotherapy for bipolar disorders. Before we speak about some of the specific options, it can be helpful to do a quick overview of more general treatment considerations when addressing bipolar symptoms. First, it's important to recognize that the gold standard in treating bipolar disorder is the combination of both psychotherapy and medication. While this video is focused specifically on psychotherapy for bipolar disorder, we want to first emphasize that medication is almost always necessary in order to make effective use of therapy. The combination of both pharmaceutical and behavioral supports puts people in the very best position to manage their bipolar illness and reduce the long-term likelihood of symptom relapse. It's also important to remember that when we're talking about therapy for bipolar disorder, we're not treating the flu. We need to set realistic expectations. It can take time to stabilize mood symptoms and learn to reduce the risk of relapse. It can take time to repair relationships, to return to responsibilities, or reestablish normal routines that may have been negatively impacted by a mood episode. So when we're talking about psychotherapy for bipolar disorder, we want to keep in mind that the aim is to gain insights and learn tools that will be used consistently in the months and years to come. Sometimes this involves maintaining a long-term relationship with your psychotherapist or other sources of behavioral support. And finally, it's important to connect with a behavioral provider who has experience in working with bipolar disorders. You want to ensure that you're connecting with a provider who recognizes that the scope and nature of bipolar symptoms are unique. It may be helpful to keep a number of questions in mind when you're first looking for a psychotherapist or initially meeting with somebody. First, you want to ask about the provider's specific areas of expertise. Generally speaking, it's better to work with somebody who has a clearly defined, particular focus on mood disorders or on bipolar disorder specifically, rather than somebody who states that they work with all types of different experiences. Asking a provider where they completed their training can also provide you with useful information. You want to make sure that the program was accredited, meaning that their training was up to current standards within the field of behavioral health. You can also sometimes determine whether or not a provider's training focus and specific experiences are a good match for your specific needs in therapy. For example, somebody looking for a more holistic approach to psychotherapy may look for a provider who has specific training in line with that particular therapeutic approach. And finally, it's important to keep in mind that good psychotherapy is a very collaborative process. It's not only reasonable, but it's encouraged for patients to ask their providers for specifics about their diagnosis and the particulars regarding their treatment plan. In other words, you want to get a clear picture about what are we doing and how are we doing it. Especially in the context of psychotherapy for bipolar disorder, it's important to be gathering data as you're progressing through treatment to monitor if the treatment is really working. Typically, this is mood charting. For more information about tracking mood, please find our mood charting video on the CoBE website. Taking a closer look at psychotherapy for individuals with bipolar disorders, we've got a range of options. The first thing to note is that there's lots of different therapeutic formats or frameworks that can be effective for individuals with bipolar disorder. Group therapy, family therapy, and individual therapy can all be quite helpful in offering support and guidance for individuals with bipolar symptoms. Regardless of modality, patients should seek out evidence-based treatments to address bipolar symptoms. These are the therapeutic approaches that have been tried and tested and have repeatedly demonstrated an ability to improve the lives of individuals with bipolar disorder. While we can't guarantee that a particular person will definitely benefit from a particular therapeutic approach, these evidence-based treatments are those that are most likely to help. Family-focused therapy, or FFT, is a psychoeducational treatment focused on improvement in mood symptoms, relapse prevention, and enhanced psychosocial functioning. This therapy consists of 3 modules: a psychoeducational module, where the family learns about symptoms of bipolar disorder and develops skills to address stressors; a communication enhancement training module, where the therapist works to improve maladaptive communication patterns; and a module focused on problem-solving skills, where the therapist teaches specific skills to address problems that create conflict in the home. Families enrolled in FFT meet weekly for 12 to 21 sessions, and over the course of the treatment work to develop a relapse prevention plan, develop communication and problem-solving skills, and improve relationships that may have been strained in the context of bipolar symptoms. Research indicates that FFT is effective for use with adults and adolescents with bipolar disorder, as well as youth who are at high risk for developing the disorder. The treatment seems to have particular impact on management of depressive symptoms and improving patients' quality of life. Interpersonal social rhythm therapy, or IPSRT, is a protocol based on the understanding that mood symptoms have a close relationship with circadian rhythms. Circadian rhythms are those daily cycles that significantly impact each of us with respect to sleep, body functions, energy levels, or cognitive functioning. While most people are impacted by changes in these rhythms, for example, switching to daylight savings time, individuals with bipolar disorder are uniquely sensitive to and impacted by circadian shifts. More specifically, unpredictable or unstable circadian rhythms increase vulnerability to mood episodes. IPSRT was developed with an aim to increase mood stability by increasing the stability of those circadian rhythms, in particular, the predictability of cycles regarding sleep, meal times, and periods of activity versus rest. The protocol also includes a relational focus, with an emphasis on improving the quality of interpersonal relationships and engagement in important social roles. Cognitive behavioral therapy, or CBT, is a well-established treatment that investigates the relationships between one's thoughts, feelings, and behaviors. CBT for bipolar disorder specifically emphasizes the ways that these relationships can shift between various mood states, and those thoughts and behaviors that are most effective when one is depressed versus feeling manic versus experiencing no symptoms. Dialectical behavioral therapy, or DBT, is an approach that incorporates modules focused on mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Skills from these modules help individuals manage intense emotions and navigate social relationships. While the treatment was originally developed to support those with personality disorders, it is increasingly used to treat a range of psychiatric illnesses. Emerging evidence suggests that DBT may be helpful in improving several core symptoms of bipolar disorder and may be particularly useful in reducing suicidality in adolescents with bipolar disorder. Individuals engaged in acceptance and commitment therapy, or ACT, work to accept their intense emotions rather than avoid, deny, or change them. Individuals are encouraged to identify their personal values and engage in behaviors that are in line with those values, even in the context of ongoing difficult emotions. With respect to its use in bipolar disorder, this treatment is offered in either group or individual treatment settings. Recent evidence indicates that this approach may be particularly useful with individuals experiencing a significant amount of impulsive behavior, experiential avoidance, and suicidal thinking. Regardless of treatment approach, psychotherapy can help improve the ability to recognize and respond to symptoms and early warning signs of emerging episodes, reduce the risk of future episodes, and help somebody feel more empowered in managing their illness. In combination with medication management, a knowledgeable therapist can offer meaningful behavioral tools and supports to effectively address symptoms of bipolar disorder.